Hormone replacement therapy or HRT is very risky business. Let's start with debunking this myth today. Each drug and in fact every decision in life has a benefit and a risk. And therefore daily we make decisions subconsciously on the basis of a benefit to risk ratio calculation. So imagine you want to invest some money in the stock market. When you buy stocks, you expect to gain some money, but there's also a risk of losing that money. And you weigh these risks and benefits before deciding to invest, right? The HRT is similar without the volatility of the market. The benefits of HRT include symptom relief, such as hot flashes and night sweats, along with protection of your bones, heart, brain, etc. And research indicates that for a woman without contraindications, usually the benefits of HRT outweigh its risks if she is under the age of 60 and within 10 years of menopause, with greater benefits if she starts it closer to menopause. Just like your stocks, where your profit is maximum if you invest when the index is at its lowest. But some of you who don't have symptoms or don't mind the symptoms may say, why make this decision at all? And the answer is because inactivity also has its own consequences that may not be visible to you today. For example, osteoporosis and UTIs may develop years after menopause. Bottom line, make an informed choice after weighing your benefits and risks with your physician.